Knowledge, beauty results, that's what you can expect at Swetnam Cosmetic Surgery. It's time for our monthly segment with our experts. We've got Dr. Swetnam and Dr. Stubbs. Welcome back. Good to see you.
Thank you. Great to see you.
Yeah.
Absolutely. Yes. So today here we're going to talk about liposuction. What is it? Let's start there.
Well, liposuction is a procedure. It's been around for a long time. There's been some changes, fairly recently, a lot of new additions to liposuction. But what it is basically removing fat. And so we use instruments to lipo is fat.
Okay.
And lipolysis is removing it. And so we're lysing the fat, removing it from the body.
Okay.
So it's a way to shape and mold a person's physique.
Sure.
Gotcha. How do you know if you're a good candidate maybe for that procedure?
Comes down to physical exam. So obviously you want it in the target areas of usually the hips or the belly or something like that. And earlier we could only liposuction so much, but now we have a technology that actually heats up the skin in a very safe manner, where normal liposuction tightens the skin 15%. Now with these new technologies, we can tighten the skin up to 50%. So that can save yourself a mini tummy tuck or a tummy tuck. So we have other means of getting the same results with less trauma.
Yeah, I see. So we're talking about contour and shaping the body, as you put it a moment ago. Is liposuction something good for weight loss?
Well, I mean, you could use it for that. We pretty much every procedure we do some liposuction. Even with facelifts, we'll liposuction the neck, breast augmentations. A lot of times we'll end up liposuctioning, in the under the arms to contour the breast and all those kind of things. So, but if you weigh 300 pounds and you want to get to 150, liposuction's probably not the way to do it.
Okay, yeah.
It's the ideal person for liposuction is somebody that's in relatively good shape, that has a problem area that we're going to correct.
Sure. And we're looking at some before and after pictures right now. If we can keep that video up. Is there something called replacements for liposuction? What is that? Can you walk us through that?
Replacements? Well, there's additions to liposuction.
Okay.
So everybody's heard of laser liposuction. Everybody's heard of Vaser, which is ultrasonic liposuction, and we have radiofrequency assisted liposuction or body tight now. And these are all, and that's kind of where we're different. There are a lot of people that do these procedures but don't really have a lot of experience with liposuction. That using those machines are an addition to the biggest part of the procedure, which is the liposuction, and that's where liposuction is a double-edged sword. I mean, it looks easy to do, but compared to everything that we do, it's probably one of the harder things that we do, because you can really screw it up if you don't know what you're doing.
That's why you got to go to the pros.
Yeah. Right.
You just talked about body tight.
Yes.
What is that?
Sure. Yeah. Body tight is radiofrequency energy that we place in the skin. It's been around for a long time, but they can monitor the temperature inside the skin and outside the skin to prevent burns. And by doing so, it heats up the dermis or the underside of the skin appropriately to where we can tighten the skin. So it's a gradual process over the next 3 months because it's a biologic change to the dermis.
Okay. So. And then Dr. Swetnam, you also mentioned Vaser.
Yeah.
Yes. Vaser's ultrasound.
Okay.
And when we use Vaser kind of selectively. I mean, you can use it. It also tightens the skin. All these technologies create heat. They create heat energy into the skin. And the difference between what he's talking about and the others is we can monitor that temperature. With the laser and with Vaser, you're always worried that you're going to burn the skin.
Right.
And so everybody under treats with them. Well, with Body Tight, you actually you can monitor.
You can tell.
Sure.
You can tell what the temperature is.
And you can set those parameters into the machine, and the machine will save you. It will turn itself off. But with Vaser, we use that for high definition. So it's a machine where you can actually etch the skin with.
Okay.
So if somebody comes in and they're in relatively good shape but have never been able to get a six-pack, we can give them a six-pack.
Gotcha.
Okay. And we know that we're breaking down some terms that may be unfamiliar to you at home. That's okay, because if you've got questions and you want to schedule an appointment with Dr. Swetnam or Dr. Stubbs, you can do just that. We've got some information for you right there on your screen. And also, don't worry, because Dr. Swetnam and Dr. Stubbs, they're our experts, so they'll be back every month breaking down, maybe answering even some of your questions that you may have on some procedures. So we appreciate you.
Yeah, thank you, gentlemen.
You.
We
Yeah.
appreciate
It's
it.
great seeing you.
Yeah,
Happy
happy holidays.
holidays.
Yes.
Merry
Yeah.
Christmas, Happy New Year.